Part 8, Aging by the Decades. This is one of my favorite parts. Now the clients are transitioning into their 50s. And while the 50s can seem like a daunting time for skincare because of the hormonal changes that are going to occur in both males and females, this is the decade that can really set a client up to be the envy of her peers or his peers when it comes to looking and feeling great about their skin. If a client has a great skincare regime, their peers will soon be asking how she looks so great, especially if she's following your suggestions. The 50s are milestone years for women and men. The aging process is apparent in fine lines that may turn into deeper ones, and the skin is experiencing significant changes. Clients who feel empowered to invest in a healthy skincare regime and the treatments that make them happy are the norm compared to earlier decades. In their 50s, they'll be dealing with even more hormonal changes, and getting ahead of the game is the perfect solution in looking fabulous later in life. Much in the coming years is because of genetics. However, how your client treats their skin will determine how they look, and how well they look after their body and skin is a big part of this. So one of the biggest contributing factors to aging is actually hydration. Dryness is a major concern in the 50s and beyond. The foremost skincare solution recommended by skincare specialists is to ensure that they're making sure that their skin is moisturized and hydrated properly. And this might mean changing their moisturizer or frequency of moisturizer both daytime and night. Exfoliation routines should change between the 40s and 50s. Very few skin types can endure the roughness caused by foaming exfoliating cleansers at this point. Should be switched to an emollient-based exfoliator. A skincare coach can emphasize the importance of a milder, milkier exfoliating solution or lotion that doesn't get sudsy. Sudsy soap-based cleansers will tend to strip the skin of oils and sebum, and while that's highly desirable once, maybe twice a week, and a good skincare coach will recommend this, it's really not effective to strip the skin every day, much less morning and night. So a milder, milkier exfoliating cleanser are effective at removing the dirt and debris without removing important oils produced by the skin that the skin needs in this decade and beyond. However, these will tend to cause a little bit of buildup, so you need a couple of days a week without any exfoliation. And ideally, the client should use a non-exfoliating cleanser, alternating with an exfoliating cleanser in this decade and beyond. In the 50s, stimulating rejuvenation is a process because rejuvenation and repairing is actually slowing down considerably. So daily exfoliation is not desirable. So what is the optimal pH level, and why is it important in the 50s? Well, this is very important. The ideal skin pH is between 4.5 and 5.5 for women, which is considered acidic, and it is between 5 and 5.5 for men. And while the pH level is constantly changing based on your diet, the sleep products the products you're using, the environment you live in, the more acidic or alkali your skin is, it can really damage its ability to deal with harmful effects of microbes or damaging free radicals that might increase the aging process. The pH level of anything sudsy is typically an alkali range over 7. It's very difficult for mature skin, especially in the 50s, to balance back to a more acidic where they should be because the metabolism is slowing down. This is the reason that a skincare coach must recommend a solution for pH balancing the skin to keep it healthy. We need to get it back to that acidic range. A skincare coaching conversation regarding why toners with a pH balancing effect are important would go something like this. The more alkali your facial cleanser, the more skin irritation you're likely to see. Acid-based pH balancing toners are designed to help neutralize any remaining alkalinity and anything that is adversely affecting your skin's optimal pH levels, which tend to be slightly acidic. Additionally, many doctors think that an imbalance in pH levels can cause or contribute to serious skincare issues like rosacea and adult onset acne conditions. Rosacea is characterized by redness, pimples, and broken blood vessels, and rosacea typically happens in middle age. It's more common in fair-skinned people and in people who have sensitive skin. It's also fairly common in women who have menopause, which makes you in particular at risk. Rosacea is, its actual causes are really unknown. Using gentle products that balance out the skin certainly reduce its risks and effects. An estimated more than 14 million people in the United States have rosacea, and most report that it becomes worse in their 50s. Regardless of whether you have rosacea or not, pH balancing in the 50s is imperative. It's possible to get a general idea of your skin pH level through careful observation. The skin that has a soft texture without dry spots would be considered to be in balance. Irritation, ruddiness, redness, dry spots may all be signs of a high skin pH level, more towards an alkaline profile. It's important in skincare sessions to talk about hormonal changes. In the 50s, clients deal with an abundance of issues, and some of the causes of these cause more changes on their skin. One of them is menopause. Menopause refers to the end of a woman's menstrual cycle production. Menopause is diagnosed if you haven't had a menstrual period for 12 months. It's a natural biological process. However, menopause for skincare causes significant fluctuations in your hormone levels, and that changes your skin. These changes affect the skin sometimes dramatically. The first concern clients will notice is a significant change in the dryness of their face, much more than it was in their 40s. While this can be great news for those with oily skin, people like that will actually be in the minority. Most people would have a combination normal or drier skin prior to going into their 50s with these, and that means their skin is definitely going to be less lubricated and drier, because without that oil production that's stimulated by hormones, they'll lose moisture quicker from the skin surface. Less lubrication and loss of moisture, double whammy. It seems that just when we need that oil production, the body stops producing enough of it. And that's what happens in the 50s. And to add to this injustice, clients can also expect to deal with enlarged pores and more evidence of their skin sagging. They might also experience occasional acne breakouts as a result of the imbalance of their hormones, particularly of seesawing estrogen levels. Postmenopausal female clients also can expect a decline in their levels of estrogen and increased levels of androgens. They may see acne they haven't seen since their teenage years, and these start to resurface because of hormonal fluctuations. One of the effects of aging skin in this decade can certainly be that it's thinner and less elastic due to hormonal changes, and your collagen and elastin production continues to decrease. So clients will correspondingly notice deepening of fine lines and wrinkles on their face. This is especially true if they haven't protected their skin from sun damage in the previous decades, or done some skin treatments to kind of start dealing with the damage that caused to their skin. Excess pigmentation and signs of sun damage like brown spots and photoaging also become really prominent now, and it's very difficult to reverse the damage unless the client's committed and diligent in using serums and exfoliation in particular. They will see improvement if they haven't used great skincare, however. And this can be really fun to watch. Pigmentation can be addressed with the combination of manual and chemical exfoliation. And one of the tips that we say is that Ellie Glow, our sponsor, um, has a fabulous 40% at home DIY rapid exfoliator, which is a mini peel, which is really fantastic. So the client would ideally use that once a week for the first 4 to 6 weeks, and then every 10 to 14 days thereafter. And that does a fabulous job for starting to exacerbate the hyperpigmentation and any sun damage that they've had. Rapid glycolic acid mini peels are excellent, as well as using brightening serums and particularly vitamin C. And even in a night cream or a serum, it's just fantastic. Also, the client might want to look into IPL, intense photo laser treatments to address age spots, intense pulsed light therapy, IPL, photo facials is a way to improve the color and texture of your client's skin without surgery. It can actually undo some of the visible damage caused by the sun exposure called photoaging. If you notice your client has age spots, hyperpigmentation, sun damage on their face, neck, hands, chest, that might work really well for them, since this is an alternative for a lot more invasive and expensive treatments. There's a section on the benefits of IPL photo facials in this course that you might want to have a look at.